Today, we're going to unravel a really fascinating medical mystery. We're looking at two genetic conditions, Duchenne and Becker muscular dystrophy. Now, what's so interesting is that they both come from errors in the very same gene, but they lead to just dramatically different lives. So let's break down exactly why that happens.
So, here's the big question, right? How can a problem in the exact same gene lead to such different outcomes? One path is incredibly severe, while the other is so much milder. Well, the entire answer, and this is the key, it all comes down to the specific type of genetic mistake and how that mistake affects one absolutely crucial protein.
Okay, first things first, a quick foundation. When we say muscular dystrophy, we're talking about a whole group of genetic disorders. And the hallmark for all of them is progressive muscle breakdown and weakness. Now, Duchenne and Becker specifically are called dystrophinopathies, which, is just a fancy way of saying they're both caused by a problem with the same protein, a protein called dystrophin.
All right, so let's get right to it and meet the main character in this story, the dystrophin protein. Honestly, if you can understand what this protein does, you've unlocked the entire secret to these two conditions.
So I want you to think of dystrophin as a muscle cell's personal shock absorber. It is this huge structural protein, and its job is to form a vital bridge. It connects the cell's internal scaffolding, its cytoskeleton, to the supportive structure outside the cell. Its entire purpose is to provide strength and stability every single time a muscle contracts and relaxes.
Now, imagine what happens if that shock absorber is gone. Or maybe it's just not working right. Well, without it, the muscle cells become incredibly fragile. Every single contraction, which is a totally normal process, now causes these tiny tears and damage. And over time, this just spirals into a vicious cycle of degeneration, where healthy muscle gets relentlessly replaced by fat and fibrous scar tissue.
And that brings us to the first of our two stories, the more severe condition known as Duchenne muscular dystrophy, or DMD. And this is a story that's really defined by a complete and total absence of that protein.
So the critical difference here, the thing that changes everything, is the type of genetic error. In Duchenne, it's something we call a frame shift mutation. Okay, imagine the genetic code is a simple sentence, like, "The big dog ate the red cat." Now, if you delete just one letter, say the G in big, the whole three-letter reading frame shifts, and the rest of the sentence becomes total gibberish. The bid dogga tet her edc a cat. And that is exactly what happens to the genetic instructions for dystrophin. The cell's machinery just can't read it, making it impossible to produce any functional protein at all. Zero.
The result of having no protein is, as you'd expect, pretty severe, and it shows up very early, usually between ages 2 and 5. What you see are things like delayed walking, kids falling down a lot, and the classic Gowers sign, where a child literally has to use their hands to walk up their own legs just to stand. Another huge clue is something called calf pseudohypertrophy. This is where the calf muscles look really big, but it's a tragic illusion. The muscle has actually been replaced by fat and fibrous tissue. The progression is fast, and most kids will need a wheelchair by their early teens.
Okay, now let's contrast that very stark picture with our second story, Becker muscular dystrophy. See, in this case, the protein isn't completely gone. Instead, it's just flawed, and that, it turns out, makes all the difference in the world.
In Becker, the mutation is what's called a non-frame shift type. So let's go back to our sentence analogy. This time, instead of deleting one letter, it's like we deleted a whole three-letter word. The big blank ate the red cat. The sentence is a bit shorter, sure, but the reading frame is totally preserved, and the rest of it still makes perfect sense. This is what happens in Becker. The genetic code produces a dystrophin protein that might be shorter or maybe a bit misshapen, but it's still there. And crucially, it's partially functional.
So, because you still have some of that shock absorber function intact, the disease is much, much milder. The onset is delayed, often not even showing up until adolescence or early adulthood. The progression is way slower, and many people are able to walk well into their adult lives. But, and this is super important to remember, the heart muscle is also affected, and cardiomyopathy, a disease that weakens the heart, remains a very serious risk.
So, we've got two very different clinical pictures, and it all stems from the same gene. How do doctors actually investigate this and confirm what's really happening on a molecular level?
Well, the fundamental chain of events, that step-by-step process of damage, is actually the same for both conditions. It always starts with the mutation. That leads to an unstable muscle membrane. Then, normal, everyday muscle contractions cause physical damage to the muscle fibers. And finally, the body replaces that damaged muscle with non-functional fatty tissue. The only difference between Duchenne and Becker is the speed and the severity of this devastating process.
So, to nail down a diagnosis, doctors have a few key tools in their toolbox. A blood test for an enzyme called creatine kinase, or CK, will show massively elevated levels because it's literally leaking out of all that damaged muscle. Genetic testing, of course, is the definitive test to pinpoint the exact mutation. And really importantly, ongoing cardiac evaluation is critical to monitor heart health.
But out of all of these tests, there's one that gives us the most direct, the most visually compelling evidence of what's truly going on with the dystrophin protein itself, and that's the muscle biopsy.
And here it is. This is the smoking gun. When you use a special stain that highlights dystrophin protein, the difference is just night and day. In a muscle sample from a patient with Duchenne, the stain finds nothing. It is completely absent. But in a sample from a patient with Becker, you can see it. It's a reduced, maybe patchy stain, but it's clearly present. There's less protein, but it is there. It's the perfect visual confirmation of the underlying genetics.
Now, while there's no cure yet, management is all about slowing the disease down and maintaining the best quality of life possible. This means things like corticosteroids to reduce inflammation, supportive care like physiotherapy and respiratory support, and, as we mentioned, critically monitoring and treating any cardiac issues. And looking to the future, there are emerging technologies like gene therapy and exon skipping that offer just incredible hope of one day being able to correct the root problem.
Okay, let's bring all of this together now. We're going to do a final side-by-side comparison to really lock in these critical differences.
This table right here, this is the whole story in one place. You can trace the entire clinical picture right back to that one key line, the mutation type. Because Duchenne has that frameshift mutation, dystrophin is completely absent. And that directly leads to a severe disease with an early onset and really rapid progression. In contrast, because Becker has a non-frameshift mutation, some dystrophin gets produced. And that simple fact results in a milder disease with a later onset and a much, much slower progression. It's such a powerful example of molecular cause and effect.
And look, if you need a really simple, powerful way to cement this in your memory for good, just think of it like this. Duchenne means dystrophin is basically deleted. Becker means dystrophin is barely present. But that barely makes all the difference in the world.
So this leaves us with a truly hopeful and pretty profound question. The massive difference between these two conditions, these two fates, comes down to having a flawed protein versus no protein at all. So, as our ability to edit genes and restore protein function gets better and better, can we one day turn a Duchenne diagnosis into something more like a Becker outcome, or maybe even better? Can we actually rewrite this tale of two fates? That's the challenge, and that's the promise for the future.